Hi, I'm Tina. I'm a third-year pharmacy student. I'm an intern here at CBS. So just want to go over a little bit about the medication. So what is your name?
Shelby.
All right, who is this medication that you're picking up for?
It's for me.
It's for you? Okay, it's for you. What medication are you picking up?
My doctor told me it was my NuvaRing prescription and then a new one, an antibiotic.
I see that you have been taking your NuvaRing for about 4 years now. I'm pretty good with that one. And the new one is your doxycycline. What did your doctor tell you this is for?
He didn't really say anything. I'm just having trouble with my acne.
Yep, so this is an antibiotic that can help with your acne, and that's what it's prescribed it for. So I'm just going to go over a little bit about the new medication. I'm going to focus on doxycycline because that is the new medication for you and about how to take it. And feel free to jump in with any questions anytime if you have any.
Okay.
All right, so I'm just going to, so this is the prescription. So it's doxycycline. It's an antibiotic. So what he prescribed for you is a 100 milligram tablet. So it's just one pill, and you're going to take it twice a day. You're going to try to take it about 12 hours apart. And for the first prescription, it's going to be for 30 days, and you have 2 refills. Another thing about taking it is you can take it with food or on an empty stomach, but one of the side effects is it can cause a little bit of stomach upset, so it's better to take with food if you do experience that. And then when you do take this medication, follow up with a full glass of water. And then make sure you separate it out by 2 hours, if you take any calcium or magnesium or any even just Tums or antacids or anything like that. A couple other side effects that you might be aware of is it can cause some diarrhea, but a little bit's normal. If you have a lot of diarrhea, just go ahead and contact your doctor because it can cause something. It can cause something called CDAD, which is C. diff associated diarrhea, and it's just something really bad you don't want to get.
Okay.
It's not fun. Yeah, and so another thing it can cause is sun sensitivity. So when you go outside, you might be more easily sunburned. If you're easily sunburned, then just try to avoid long-time exposure to the sun or put on some sunscreen as well.
Okay.
Just making sure I don't miss anything. So if you do experience some severe side effects such as chest pain or sometimes your liver might have some issues. These are rare, but it is something to look out for to keep monitoring. It'll be yellowing of the skin or yellowing of the eyes. You just want to call your doctor right away. So how often are you going to take this medication?
Did you tell me 2 times a day?
Yep, so about 12 hours apart. And then, so they did give you 60 pills, so it will help with your acne, plus we get you looking better in those engagement photos, which I'm sure they're fine. Yeah. So just make sure you want to take it every day, about 12 hours apart if you can. And if you do miss a dose, if it's closer to the dose that you missed, go ahead and take it right then and there. If it was already closer to the next dose, just go ahead and skip that one and resume your normal schedule. Don't double up on the dose, so don't take 2 pills at one time for the doxycycline. And then with your NuvaRing, I see that you have been taking it, and your doctor also wrote another prescription for this one with 1 refill. So that's 2 months worth of the NuvaRing. I see that you've also been compliant for it. What issues have you had with NuvaRing?
Nothing really, I don't think.
Yeah, we can just go ahead and just review it a little bit because sometimes it's nice to have a refresher. So NuvaRing, it's for your birth control. Have you been having your periods every month and everything? Everything seems to be going pretty well? Yeah. Yep, so one thing with NuvaRing and your doxycycline that I noticed is that there might be a drug interaction. Usually NuvaRing and some antibiotics can have a drug interaction, but with the doxycycline, there's a low risk for this interaction. But one way to continue monitoring, and this is why I asked about your menstrual periods, is to keep making sure that you do have your monthly menstrual periods. If after 2 months you have not had a menstrual period, go ahead and take a pregnancy test, and if it's positive, call your doctor. So about NuvaRing, show the assumption you know how to apply it. You open the foil pouch and you pinch and insert it for 3 weeks, and then remove it out for 1 week, and then restart the cycle. What did your doctor tell you about missing it, when it falls out?
He hasn't told me anything about it.
So sometimes it may fall out. So if it's been, it depends how long. If it's been less than 3 hours, you can go ahead and just rinse it and insert it back in and resume your normal cycle. Or if you've lost it, just go ahead and open up a new one. But if it has been more than 3 hours, you can still reinsert it after rinsing it with lukewarm water or a new one. But go ahead and use a backup method for 7 days. So So, what did your doctor tell you about smoking with NuvaRing?
Nothing. He didn't tell me anything.
Yeah, and I do see that you are a non-smoker, so that's pretty good. But so like one of the major side effects that we watch out for with NuvaRing is blood clots, something like that. So really don't want that. So smoking really increases the chances and also increases as you age more. But you're still pretty young and still pretty low chances of that. What questions do you have for me?
I don't think anything. You did a good job.
Alright, thanks. Well, just call us at this number if you have any questions.
Okay. Thank you so much.